Here is our second bedtime lesson, which is about root canal treatment. We're going to look at the overview first and how it's performed. Root canal treatment, also known as endodontics, is a dental procedure used to treat infection at the center of a tooth. Root canal treatment is not painful and can save a tooth that might otherwise have to be removed completely. But why is it needed? The infection at the center of a tooth, the root canal, is caused by bacteria that live in the mouth and invade the tooth. This can happen after tooth decay, leaky fillings, damage to teeth, as well as a result of trauma such as a fall. Tooth structure. A tooth is made up of two parts. The crown is up the top part of the tooth that is visible in the mouth. The root extends into the bone in the The root extends into the bone of the jaw, anchoring the tooth in position. Teeth also consists of enamel, the hard outer coating, dentin, a softer material that supports the enamel and forms most of the tooth, cementum, a hard material that coats the root surface, and dental pulp, the soft tissue at the center of the tooth. The root canal system contains the dental pulp and extends from the crown of the tooth to the end of the root. A single tooth can have more than one root canal. When root canal treatment is needed. Root canal treatment is needed when dental x-rays show that the pulp has been damaged by a bacterial infection. The pulp may become inflamed if it's infected by the bacteria, allowing the bacteria to multiply and spread. The symptoms of a pulp infection include pain when eating or drinking hot or cold food and drink, pain when biting or chewing, a loose tooth. As the infection progresses, these symptoms often disappear as the pulp dies. Your tooth then appears to have healed, but the infection has in fact spread through the root canal system. You eventually get further symptoms, such as pain when biting or chewing returning, swelling in the gum near the affected tooth, liquid oozing from the infected tooth, or a swollen cheek or jaw, or the tooth becoming a darker colour. It's important to see a dentist if you develop toothaches. If your tooth is infected, the pulp cannot heal by itself. Leaving the infected tooth in your mouth may make it worse. There may also be less chance of the root canal treatment working if the infection within your tooth becomes established. Antibiotics, a medicine to treat bacterial infection, are not effective in treating root canal infections. They can though help to treat infection that spreads beyond the root and causes swelling. Now here's the phases how they do it. How root canal treatment is done. To treat the infection in the root canal, the bacteria needs to be removed. This can be done by either removing the bacteria from the root canal system, removing the tooth, called extraction, but removing the tooth is not usually recommended, as it's better to keep as many of your natural teeth as possible. Before having root canal treatment, you usually be given a local anesthetic. This means the procedure should be painless, which means your mouth the local anesthetic will numb your mouth, and no more unpleasant than having a filling. After the bacteria has been removed, the root canal is filled and the tooth sealed with a filling or a crown. In most cases, the inflamed tissue near the tooth will heal naturally. Root canal treatment is usually successful. In about 9 out of 10 cases, our tooth can survive for up to 10 years after its root canal treatment. Recovering from root canal treatment. It's important to look after your teeth when recovering from root canal treatment. You should avoid biting on hard foods until your treatment is complete. After your final treatment, your restored tooth should no longer be painful, although it may feel sore for a few days. You can take over-the-counter painkillers such as paracetamol or ibuprofen to relieve any discomfort. Return to your dentist if you still have pain or swelling after using painkillers. In most cases, it's possible to prevent the need for further root canal treatment by keeping your teeth clean, not eating too much sugary food, giving up smoking if you smoke. Find out how to take care of your teeth and gums. Now, how is it performed? Is our final part of the lesson. Root canal treatment is carried out by a dentist over 2 or more appointments. Preparing for root canal treatment. Before having root canal treatment, your dentist may take a series of x-rays pictures of the affected tooth. This allows them to build up a clear picture of the root canal and assess the extent of any damage. Root canal treatment is usually carried out under local anesthetic, a painkilling medicine that numbs your infected tooth and the gum around it. In some cases where the tooth has died and is no longer sensitive, it may not be necessary to use it. Removing the pulp. Your dentist will place a rubber sheet or dam around the tooth to ensure it's dry during the treatment. The dam also prevents you swallowing or breathing in any chemicals that the dentist uses. Your dentist will use a drill to open your tooth through the crown, the flat part at the top, to access the soft tissue at the center of your tooth, the pulp. Then they'll remove the pulp. Then they'll remove any infected pulp that remains. If you have dental abscesses, which is a liquid-filled swelling, your dentist will be able to drain it at the same time. Cleaning and filling the root canal. After the pulp has been removed, your dentist will clean and enlarge the root canal. The root canal is usually very narrow, which makes it difficult to fill. Your dentist will use a series of small files to enlarge the canals and make them a regular shape so they can be filled. This part of treatment may take several hours and may need to be carried out over a number of visits. Your front incisor and canine teeth, also known as biting teeth, usually have a single root containing one root canal. The premolars and back molar teeth, chewing teeth, have 2 or 3 roots, each containing either 1 or 2 root canals. The more roots a tooth has, the longer the treatment will take to complete. If the treatment needs to be carried out over several sessions, your dentist may put a small amount of medicine in the cleaned canal in between visits to kill any remaining bacteria. The tooth will then be sealed using a temporary filling. If you have symptoms from the infection, such as a raised temperature or large swelling, you may be given antibiotics to help manage and prevent further infection. Sealing and fixing the tooth. At your next visit, the temporary filling and medicine within the tooth is removed, and the root canal filling will be inserted. This, along with the filling, seals the tooth and prevents reinfection. Root-filled teeth are more likely to break than healthy unrestored teeth, so your dentist may suggest placing a crown on a tooth to protect it. In some cases, a root-filled tooth may darken, particularly if it's died as a result of injury like a knock to the tooth. In some cases, a root-filled tooth may darken, particularly if it's died as a result of injury like a knock to the tooth. There are several ways your dentist can treat discoloration, such as whitening the tooth using chemicals. Adding a crown. A crown is a cap that completely covers a real tooth. It might be necessary to use a crown after root canal treatment to prevent the tooth fracturing again. Crowns can be made from metal or porcelain, or both, a ceramic material or powdered glass. The dentist will use a drill to reduce the size of your tooth and use the crown to replace what's removed. A mold of your tooth will be taken to ensure the crown is the right shape and size, and fits your tooth accurately. When fitting the crown, cement will be used to glue the crown to the trimmed down tooth. If there's only a small amount of tooth left after the root canal treatment, a post can be cemented in the root canal and used to help keep the crown in place. How successful is it? Root canal treatment is usually successful at saving the tooth and clearing the infection. Around 9 out of 10 root canal teeth survive for 8 to 10 years. Having a crown fitted to the tooth after root canal treatment is important for improving tooth survival rates. If you keep your teeth clean, your treated tooth should survive for a long time. The survival of a tooth depends on a number of factors, including how much of the natural tooth remains, how well you keep your teeth clean, and the biting forces of your tooth. But if infection does return, the root canal treatment can be repeated. Or if treatment has already been carried out to a high standard and the infection remains, a small operation is to remove the root tip, and an apicoectomy may be carried out to treat the infection. Time for our bedtime bird.